Melanie and Rachel, and today we are presenting on injuries. So, injuries affect the growth and development of each person at different stages in their life. The four types of injuries are mechanical, heat and cold, electrical, change in pressure, and radiation. Certain age groups are at higher risk for certain injuries. Injuries among these age groups are very similar. Most of them are from falling, scraping knees, choking, abuse, and car accidents. So some examples for infants would be burn, suffocation, drowning, abuse, poisoning. Toddlers are relatively the same, but they're more prone to fractures at this stage compared to the infant. And then children are prone to burns, drowning, motor vehicle accidents, falls, scrapes, bruising, and fractures. Adolescents are prone to falls, fractures, lacerations, head injuries due to not wearing helmets, motor vehicle accidents, and sport accidents. Very similar, adults are susceptible to motor vehicle accidents, alcohol-related accidents, fractures, and lacerations. And elders are at high risk for falls, fractures, lacerations, bed sores, injuries as a result of abuse, injuries as a result of fires, and other health complications. Factors that affect growth and development. So injuries may stunt a patient's physical and mental growth. Some injuries will require physical therapy in order to regain strength and increase functionability. Others might require occupational therapy. An example for this is hip displacement. So hip displacement in infants might prolong their developmental milestones of walking, and a result of an injury, the child is now developmentally behind its peers. Other factors that affect functional development. So injuries may result in deformation and a decrease in functional ability of physiological or psychological functions. An example of this is chronic pain. Chronic pain may result in a decreased functional ability of both physiological or psychological functioning. For example, chronic pain in a student may decrease their mobility and affect their ability to learn and concentrate. Chronic pain hinders a patient's ability to enjoy and carry out their daily life.
Some genetic conditions that increase risk for injuries include fibromyalgia, which causes muscle pain and fatigue, fibrous dysplasia, which replaces healthy bone with other types of tissue, Marfan syndrome, which affects connective tissue, osteogenesis imperfecta, osteoporosis, and Paget's disease. One exemplar of an injury causing disease is osteogenesis imperfecta, or brittle bone disease. This is a rare and complicated disorder that mainly affects the bones, but also affects all our other body systems too. People with OI experience frequent broken bones, respiratory problems, vision problems, easy bruising, and brittle teeth. People with OI exhibit a wide variation in appearance and severity. Severity is described as mild, moderate, or severe. The most severe forms lead to early death. There is no cure for OI, but there are many ways to manage the symptoms. Treatment may include fracture care, physical therapy, surgical procedures, medications, and mobility aids. Some precautions to take while caring for people with OI include never pushing or pulling or bending on a limb, handle babies with extra care. When a fracture is suspected, minimize handling of the affected limb. Use caution when inserting IVs, taking blood pressure, or performing other medical procedures to avoid causing injury. Always dose medications to the size, not the age of short-statured adults. And lastly, respect the opinions, advice, or instructions provided by parents, children, and adults with OI. Based on experience, they give good directions for the safest ways to lift, carry, or reposition. There are many different treatment options for injuries. One option is PRICE therapy, which stands for protection, rest, ice, compression, and elevation. This type of therapy can help treat minor injuries like sprains. It can reduce swelling and prevent further injury. Pharmacological interventions for injuries are used to reduce swelling and ease any pain. Aspirin should not be given to children under 16 years old. Immobilization can help prevent further damage by reducing movement. It can also reduce pain, muscle swelling, and muscle spasms. Physical therapy can help people recover from long-term injuries, and very serious injuries may require surgery.
Patient-centered care. Factors that influence patient-centered care include type of injury and patient's wishes, beliefs, or cultural preferences. Patient-centered care should focus on making the patient as comfortable as they can be while actively treating and preventing injuries. This looks different for every patient and every different scenario. These are some of our resources.